Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. In our Healthy Minutes segment brought to you by OGPay.com, today we're featuring returning guest, Dr. David Rankin, founder of David Rankin MD. You can head directly to their website, Chief of Plastic Surgery at St. Mary's Medical Center in West Palm Beach. Now, Dr. Rankin has been in practice for over 20 years, and recently he has become well known in the BII community. That's breast implant illness. Dr. Rankin stopped implanting women and solely focuses on explant procedures. He's joined today by Dee Hicks, his practice's explant liaison. Now, Dee helps women navigate their explant process and supports them throughout their journey. Today, they're joined by explant patient Danielle Coryn, CEO of Lashaholic in Stuart, Florida. Today, we're chatting about breast implant illness on the rise and what you should be aware of if you have or are thinking of getting breast implants. Now, the history of breast augmentation has grown from trial and error over the course of the last 60 years. The first silicone implants were placed in 1962 by Cronin and Garrow. Over 4 million women across the globe have undergone augmentation for a multitude of reasons, including but not limited to oncological reconstruction, cosmetics, and trauma. It's clearly evident that this procedure does not come without risks, as recently thousands of reports have been filed regarding symptoms and health conditions believed to be associated with implants. Symptoms include but are not limited to fatigue, brain fog, joint pain, swellings, inflammation, and even certain types of cancers. Symptoms can affect anyone regardless of implant type or length of time since insertion. Model and reality TV star Black China and race car driver Danica Patrick recently opened up about their decision to undo years of cosmetic work and get their breast implants removed. In 2020, plastic surgeons removed more than 36,000 breast implant augmentations. That's almost a 10% increase from the previous year, and that's according to the American Society of Plastic Surgeons. Here today to chat BII, how to identify and reverse the symptoms and take back control of your life are my experts at hand, Dr. David Rankin and Dee Hicks, joined by explant patient Danielle Coryn. Welcome to the show, my friends.
Thanks, Anne.
Hello. Thank you for having us.
Thank you.
Thank you for joining me, my friends. All right, Dr. Rankin, we'll start with you. In March of this year, the FDA issued a safety communication with updated information about squamous cell carcinoma, SCC, in the scar tissue around breast implants and recommended healthcare providers talk with patients who have or are considering breast implants about SCC and various lymphomas in the capsule around the implants and ask that they properly outline the dangers. Now, do you think plastic surgeons are truly warning patients? And more importantly, why did you decide to only focus on explanting?
It's a good question with the new squamous cell diagnosis. It's something that we really haven't seen in the past. We have known recently about the lymphoma, which is a rare disease which forms around the capsule. But until recently, we found out about the squamous cell problem. The differentiation is that the lymphoma, if diagnosed early, has a fairly good prognosis, but the squamous cell, if patients develop this, has a very poor prognosis. So it's definitely a concern that all plastic surgeons should discuss with their patients prior to even considering breast augmentation. Do I think that every plastic surgeon tells the patient these risks? No, I don't at this point. I think that's an important part of educating both the doctor to educate the patient. And as far as myself not implanting anymore, it's something I did early in my practice. Once I noticed patients having issues with breast implants, breast implant illness, and the other multitudes of problems that they can develop, I just decided to take a stand and not do augmentation anymore and just focus on making patients better and trying to get as much of a perfection in my technique as possible to still make patients healthy and also to get a good cosmetic result.
Extremely honorable of you, and that's why we love you. Danielle, why did you decide to get breast implants, and how long after implanting did you start to see your symptoms?
So I actually got them 18 years ago. I decided to get them because I had a very large discrepancy in the sizing of my breasts. So at that age, it was uncomfortable for me. I just felt like to have the perfect body, right? I needed to have everything even. And over the years, they just got larger, I guess, as I had children and things like that. And I would say that I probably a few years in is when I had really awful sinus issues, and I kind of related. I don't know if it is again, but I relate it back to all of that because it's so much internal things that just all connect. Um, but my joint pain and my migraines were absolute worst, and that happened just about probably about 5 years ago is when those really started. And I couldn't live with it anymore. I just really wasn't myself, if that makes sense.
Yeah, you had implants for 18 years. About 5 years ago, you started getting these aggressive symptoms like migraines and joint pain and inflammation, and you equated it to that. And so now you have explanted. You're about a week with no implants.
Yeah.
How are you feeling?
I am 1 week exactly today. And it's kind of crazy that I can say the next day that I felt amazing. Like, so there were days I couldn't even like move my hands open and close. I was getting panels done for rheumatoid arthritis, all the different blood panels done, and everything was coming back inconclusive. And I had no answers for anything. And today I feel like I can play with my kids. Obviously I'm only a week out, so I have to monitor
Yeah,
that.
you got to be careful. You got ways to go, but I'm glad you started feeling
I
so
feel
much
like
better.
literally
Okay,
incredible.
I love it. Great outcome. Dee, you also explanted in 2016 after suffering tremendously with breast implant illness, and you've been an advocate for women for close to a decade. You've attended and spoken at FDA meetings in Washington, D.C. You've advocated for breast implant safety. You've helped get the textured implants recalled off the market, and even played a role in having the FDA issue a black box warning for all breast implants. Phenomenal stuff. Now explanting comes at a high cost, roughly over $15,000, maybe plus travel and more is what one can expect. Yet most patients are so desperate to feel like themselves again that they're willing to do and pay almost anything. Nobody gets breast augmentation to shortly after explant. What do you say to the medical community that says this is hogwash and that this is all psychosomatic and that it's in their head, so to speak?
What I would say is even on the implant manufacturer's own pamphlets, it lists, a host of symptoms like autoimmune, hair loss, and that type of stuff. It's also listed on the FDA website, but nothing comes. It's not one size fits all for everybody. So everybody's bodies are different. They react different to the devices within them, and the breast implants definitely have an effect on the body for sure.
I couldn't agree more. And you experienced it yourself
Yes, I
because
did. I did. I had 54 symptoms on the day of my surgery. And when I woke up, much like Danielle, 45 of the 54 were gone. I looked like a different person. I lost 12 pounds of inflammation. And I mean, it was absolutely remarkable.
amazing. And you decided to empower yourself. And now you are the explant liaison at the practice and you help women navigate through their journey and they at least can talk to somebody that has been there before. It's pretty amazing that this all exists within the ecosystem of Dr. Rankin, which is phenomenal. Now, Dr. Rankin, what exactly is in these implants that may be making some women sick?
Well, we're not totally sure about the cause. We don't know the direct cause and effect. All the implants, whether they're saline or silicone, or most of the implants are made of silicone. Even the saline implants have a silicone outer shell. So we think potentially the silicone itself has something to do with reacting to every individual's body. There's also a lot of proprietary materials within the implants, which are now, per the FDA, going to be given to patients or supposed to be given to patients to see what's in them prior to implanting. Also, that's one of the changes that have been made. But the answer to your questions, then, is really at this point we just don't know. There's studies that are being done through the American Society of Plastic Surgery, evidence-based medical studies that we're really trying to figure this out.
And it's interesting because Danielle said she feels better right away. I mean, within a few weeks, right now. But typically, what is the prognosis in terms of after you've explanted? on average, when will women start to see and feel symptoms reverse, especially the ones that had severe symptoms?
Yeah, in my practice, there's really no rhyme or reason. I see patients like Dee and like Danielle who feel great right away. And the proof is in the pudding, where you monitor these patients 6 months out, a year out, and the symptoms are still gone. Other patients take a little bit longer. I've had patients that take up to a year to start feeling better. But I think the majority start feeling better a little bit sooner than later. So that's the answer to that question.
Yeah, there you go. Um, D, so breast implants, obviously, we know at this point are not lifetime devices. And the longer you have breast implants, of course, the greater the chances are that you're going to develop complications, some of which will require some surgery. Now, insurance companies have become a bit more flexible with regards to the use of diagnostic ultrasound instead of expensive MRI. But we also know that MRI is critical because it can see what a mammogram cannot. And a lot of women with breast implants are opting not to get mammograms because of the potential for ruptures. Now, of course, an MRI, it can help really verify implant integrity, orientation, periprosthetic fluid, capsular calcification. In the case of older implants, gel bleed and extracapsular gel. But while most people don't experience complications, identifying, of course, a rupture is important. But how would a patient go about getting this approved with their insurance company? And how often should we be screening with MRIs now potentially being covered?
I believe the MRIs are recommended annually. As far as the insurance goes, it's really what I recommend to ladies is to, once they start the explant process, to look at their insurance policy and check under breast health to see if they offer, any type of coverage for implant removal. That's the best place to start. We are seeing that the insurance companies are, becoming better at giving the women some sort of reimbursement for it. When I was at the FDA, one of the topics that they spoke on was, well, it's a surgery that is elective, and it's not their fault, so to speak, that we got sick. But if you look at, take a smoker, if I smoke cigarettes and I get cancer, insurance is going to help pay for that and remedy it. So
Yeah.
they are helping.
They are helping. And of course, I know now for women with implants, the MRIs are now also being authorized once a year to be able to see better because of course, the ultrasounds don't really show what the MRIs are showing. So that's interesting. It's a shift on the insurance carrier's part, and I'm glad it's happening. Now, Dr. Rankin, currently right now, what viable procedures exist for reconstruction after explanting, and how much volume can you really get?
Short of putting in an implant, there's a couple things you can do. You can use what's called autologous tissue reconstruction, which is using parts of your body, like the tram flap, which is it's a tummy tuck, and it rotates the abdominal tissue up into the breast to create a mound that's your own. So that's a viable way. It's a little bit more intensive on the surgical procedure. Fat grafting is becoming a little bit more prominent, which is liposuction and taking that fat and injecting it into the breast. There's still limitation in how much volume you can get. Usually we say a half cup to a cup size increase in volume with fat grafting, but still there's often not as much of upper pole fullness that women want with the fat grafting technique. And sometimes you'll need multiple procedures to get the result that you want to achieve.
Interesting. There's amazing technology that, of course, has propelled the way for all of this. But, it still remains to be expensive, and it still remains to be a gray area for options for women that don't want to, put anything foreign in their bodies. And at this point, it's a huge percentage. Danielle, what is your one piece of advice to all women out there with implants or considering getting a breast augmentation?
So I've actually been asked a lot about this. And I think my one piece of advice would be just do your homework, really look into everything. It's got to be a personal decision for yourself. This is for you and for your health journey only. Whatever makes you happy, just going into it knowing that if you decide to get implants, they might be coming out, because there is no telling if you're going to get sick or not. And with the amount of cases that are rising, it's just inevitable at this point.
Well, you're right. You're 100% right. It's really, you said it. You're being transparent, and that's the truth. You're giving it to people straight because you experienced
Yeah.
the negative side of that pendulum swinging, and it probably cost you a lot of time, effort, money, and mental health. So you're speaking like a mom should.
Yeah.
D, you see women recover remarkably well and slowly claim back their lives and bodies. What do you love the most about working with Dr. Rankin?
It's such a rewarding job. By the time the women, find out or research breast implant illness, they've been to multiple doctors testing. On my own personal experience, I spent $15,000 the 2 years before just on oncologists, infectious diseases, biopsies, all kinds of testing. So, we're kind of like the light at the end of the tunnel, and to see them, come scared, broken, felt gaslit by the medical community, feeling like they're crazy, to like Danielle waking up and that's more common for most, that they wake up and they feel an instant sense that they can breathe better, and their skin clears up, their eyes look clear, so it's kind of like a rebirth. You get to see them come as like a broken woman, and they leave these beautiful, empowered, healthy women, and it's just so rewarding.
Well, I can't agree more, and I've had personal friends and family members that have
Mhm.
experienced your service, and you are right on it. You are warm, you are transparent, you are honest, you are professional, and it speaks a great deal to David Rankin, his ecosystem, of course.
Thank you.
It was a pleasure chatting with all of you. Danielle, thank you for being so brave and coming on and being transparent and really paving the way for other women out there and taking a stance with your body and of course, claiming it back after 18 years. Congratulations.
Thank you very much.
Dee, you are incredible. Thank you for being you and paving the way for women that feel like they really need somebody to hold their hand on this journey.
Thank you so much.
And Dr. Rankin, you know what I feel about you.
Thanks, Sam. It's great being on your show again.
That was our Healthy Minutes segment brought to you by ogpay.com. And that was the amazing Dr. David Rankin. You can check him out directly on his website at davidrankinmd.com. Definitely check out Danielle Coryn at Lashaholic Lashes.com. And that was Dee Hicks, implant liaison at David Rankin MD. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by Caldwell Soames Incorporated, investing globally in transformative businesses like Original Digital Corporation, or ODC. ODC develops advanced consumer and commercial fintech solutions such as OGPay, which will transform the way you manage your money. From sending and receiving money globally for free, paying for goods and services in person and online, pay bills, buy and sell digital currencies, all while earning interest. OGPay is easy to set up, FDIC insured, and your information is secured. Check out ogpay.com.